TikTok is a short video sharing social media platform that has grown quickly since its launch, garnering over 1 billion monthly global users. Although we might get lost in the endless scrolling and engaging aspects of this platform, today we'll be learning about some of the public health concerns related to TikTok and what we need to know in order to better protect our populations from adverse health outcomes so we can better inform decision makers, health providers, researchers, and you, the listener.
This is the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
My name is LaShawn, and you're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about diverse career opportunities that exist in the field. And I'm here with a very special guest. This episode's guest is a PhD student at the London School of Hygiene and Tropical Medicine, where he studies public health and policy. His research interests include the commercial determinants of health, misinformation, big tech, and online portrayals of health and wellness. He is also a research associate at the University of British Columbia, where he conducts research to support young people and their mental health. Marco Zanone, welcome to the Public Health Insight Podcast.
Many thanks for having me.
Awesome. So one of the things I always wonder when I meet someone who's pursuing their PhD is what led you to pursue it? I find that many people, after finishing an undergraduate degree or master's degree, find themselves pursuing a PhD next as their next step in their professional trajectory. So can you tell me a little bit about your journey of how you came to be a PhD student?
Sure. My journey to be a PhD student, similar to a lot of PhD students, it isn't a linear process, but something sparked my interest in undergrad, and that was the promotion of sugary drinks. And when I started to think about it more and more, I thought it was really unfair of how these companies acted to promote sugary drinks and how that affects people. So that manifested into different interests and different research projects that kind of led me to the PhD, and so studying corporations and how their actions can impact health.
Fantastic. And, how did you, go from one research position to another? Because a lot of people are always asking me, how do I know when I want to pursue a PhD? Like, how do I know that I'm interested enough into a topic that I can pursue a PhD?
My advice would be, if you're going to pursue a PhD in any topic, not to look at an academic position as the reason for it, but mainly how you can use your degree for your advocacy and how you can use it to advance your principles or your values. So for me, my PhD is an outlet that I can use to advocate on issues that I think are important. And you can transfer that really to any kind of scenario or real world position.
Fantastic. And so, as I mentioned in the introduction here, we all know social media plays a big part in many people's lives. And behind social media are these big corporations that you mentioned. And although there can be a lot of positive aspects to it, we're finding that similar to what we're seeing during the COVID-19 pandemic, there's also a potential for a lot of harm. And interestingly, though, one of the ways I came across the paper that we'll be discussing today is through Twitter. It actually went pretty viral and it happened to come across my feed and I reached out to you. So how did you come up with this idea to write a commentary called TikTok and Public Health, a proposed research agenda?
Definitely. And I really like how you highlighted that social media can be good and it can be bad. And it's important to state that before I think we go into too much of the TikTok stuff, in that a lot of people who study social media and have this critical perspective aren't against social media. But the reality of it is that we do have to study it. We also have to hold the companies that administer social media platforms accountable for safety and for public health. For the TikTok paper, we kind of came to this idea after realizing that there's over 1 billion monthly TikTok users, but there's almost no research into the platform.
Mm-hmm.
We've seen in the past the consequences of when social media is left unchecked and how disastrous that can be in some scenarios. So from our perspective, we think it's imperative to study TikTok, get proactive research, all with the goal of making the experience as safe as possible for people and to advance public health interests.
Yeah, fantastic. And, I like to hear a bit about how you came up with the actual idea of, or the process of, maybe you went up to your supervisor and you're like, hey, I'm interested in TikTok. And what was your supervisor's reaction? Or was this more of a collaborative process? Because it's an interesting area. Like, a lot of our listeners, they benefit from TikTok from various entertainment purposes and may get lost in the long scrolling through the videos that are on the platform. But maybe a lot of people don't see it as a public health issue. So how were you able to kind of advocate for the idea that, hey, this is in fact a public health issue?
Yeah, that's a great question. How that conversation happened with my co-authors and I is that we come from different backgrounds. My co-authors come from more of this clinical background, and we work directly with youth in their positions. They're part of this integrated care network in British Columbia, and it's all about advancing the mental health of young people. And then my background is more of studying these corporations and how they act and how that can affect public health. So we kind of had the discussion about how we know young people are using TikTok, and we know that they're using it a lot, and they're getting all sorts of information and advice. And in the context of how this paper came to be, we had a conversation one day talking about how young people were getting mental health information from TikTok and how that was kind of affecting, not in a bad way, but just how it was impacting some of the service delivery at Foundry with people getting their information from there. And so from my perspective, I think, well, that's a great thing, sparking mental health conversations. But there also is risk to those young people as well being on TikTok so much. So we first started talking about how, they're getting information, which is always good, but we don't know the accuracy of that information. And if you give bad information on TikTok, that can lead to some decision making, perhaps, that isn't in the best interest of that young person's mental health.
Right.
So from that conversation, we kind of talked more and more and more. And then we looked into the research on TikTok and we found that not much was there. So we thought, instead of just saying that we have to call for mental health research on TikTok, we're going to take a higher look. We're going to leverage both of our perspectives, and we're going to see what kind of research agenda we could produce for global health to pursue.
Yeah. And I'm so glad you put out this paper, because just from that sheer number of people alone that we mentioned, over 1 billion people that are every month are kind of going through TikTok, it has the potential to have a lot of impact in shaping people's behaviors, thoughts, and attitudes. So definitely this proposed research agenda that you and your colleagues are proposing at a higher level and at that global level is an important consideration, because oftentimes when you're looking at granting or funding agencies, they might not think of this being an issue of public health. And like you mentioned, it definitely is, because it has a lot of implications for individuals' mental health, whether it's positive or negative. We don't have enough information at this point, is what you're trying to say, right?
Absolutely. And we know that the people who use TikTok are mainly young people. So a study came out in 2020 where kids are spending on a daily average, about 80 minutes on the platform. So we know they're using it a lot. So we do have to pay attention to that.
Right. And, personally, I don't have TikTok, but for the purpose of this conversation that we're having, I downloaded TikTok a couple of days ago. And I got to say, as soon as I started scrolling, I lost like 2 to 3 hours of my life. I was just so into it that, video by video, things became more entertaining. And, before I knew it, it was time to go to sleep. And it didn't feel like I spent 2 to 3 hours on the site, but it was super engaging, and it like drew people in with these short videos. So could you talk a bit about what is TikTok, like, for those who don't know what the TikTok platform is?
Sure. And thanks for sharing your experience on that. I think that's a very common experience. So TikTok is a social media platform where you view short videos. Most of them are under a minute long, and you can view as many videos basically as you want to consume at a time. So one of the kind of features of TikTok that people like is that when you scroll through, it's an endless scroll. So there's always going to be some kind of content for you to view. And one of the things about TikTok that makes it so successful is its algorithm is very apt at figuring out what you want to view. And it can figure out fairly quickly what your interests are and what's going to keep you on the platform. So for example, if you like videos of dogs, for example, you'll see lots on the platform. And that experience is quite engaging, and it can be very entertaining, just as you were mentioning.
hmm So, in your actual commentary that you wrote up with your colleagues, you mentioned six key public health related concerns. And one of the first ones that you mentioned is this idea of health harming product promotion. Can you tell me a bit more about what this is and maybe an example to drive this point home and some of the implications?
Sure. So social media platforms have really become where what we call health harming products can be promoted from and to reach certain groups. So when I say harming products, I mean tobacco, alcohol, vaping products, ultra processed foods, and similar things like that. We've seen in the past with these health harming products how they kind of leverage social media and in particular influencers to promote their products, usually to young people. We've seen this happen on Instagram, for example, recently with some pretty severe consequences. So for example, if we look at Juul, we can see
Yeah.
that Juul employed Instagram influencers and affiliate marketers to promote their product, even though they publicly stated that, that's not something that they've ever advertised. But what that led to was all this peer-to-peer marketing, and Juul became almost a trend. And now we see vaping concerns across, where I live in Canada or in the United States, to the point where, in some areas, school administrators have to take the doors off the bathroom because people are going to, the school bathroom to vape. So that's just one example. But the research on TikTok so far with health harming products is that even though most of these products are prohibited from being on the platform, they can still be kind of represented in this positive way. And we don't know yet if they're actually being promoted by any sort of company or anything like that. In the little bit of research that's happened so far, we've seen products like alcohol be promoted and represented in a really
hmm
positive way. So a study that I mentioned in the commentary is out of the top 100 videos with the alcohol hashtag on TikTok, 98% represents alcohol in a positive way. And when we think about the user base of TikTok, young
hmm
kids, that could suggest something fairly quick, and it can normalize something that shouldn't be so normal at a young age. And similar studies have been conducted on vaping, as I mentioned. So another study that happened was 808 vaping videos from the top 1,000 were retrieved. And they were viewed almost 1.5 billion times. And 63% represented vaping positively. So when we think of young people, they're consuming all this content, that can suggest something that's very concerning for public health very quick.
hmm Right. And you bring up a lot of great studies and points here. Like, 98% of these videos positively show alcohol use as a positive thing. And it really reminds me of a lot of the targeted campaigns in, traditional media like TV, radio, where they portrayed cigarettes or alcohol in very appealing ways. So like having sex appeal and having that cool factor and utilizing people of that demographic as kind of their representatives to show that this is the thing to do if you're someone that looks like me. So is that a lot of the things that we're seeing on TikTok now?
I think I don't want to speculate too much, but right now, I think that's something that we have to look into. The research is just in its infancy so much that we just don't know. We
Mhm.
don't know how, for example, different companies that have used influencers in the past are using
Yeah,
TikTok. And I
right.
think that's one of these areas that public health really needs to look into and really be proactive on before we see more harm.
And like I kind of mentioned early on, that one of the next areas that you mentioned is this idea of disinformation and misinformation spread. So, like other platforms like your YouTubes, the Facebooks, the Instagrams, you always have the capacity for individuals to put out disinformation and misinformation and have that spread and have individuals that are susceptible also believe these things and share with their networks. And then it causes this huge amplification effect which leads to really adverse consequences in a lot of the public health initiatives, such as vaccine uptake and other health promoting behaviors. So, how does this manifest in like a platform like TikTok with over 1 billion users?
Yeah. So misinformation and disinformation is a problem for all social media companies right now to confront.
hmm
And when we think of the sheer scale of social media companies, 1 billion users, you have to think of how much content moderation that must take to really prioritize what kind of disinformation and misinformation
Right.
is on the platform and trying to remove it.
Mhm.
If you really think about that, 1 billion accounts, right? And you're trying to make sure that no harmful disinformation or misinformation comes from that. It's a huge task.
Mhm.
And right now on TikTok, we don't know a lot of what's happening with regards to that topic.
Mhm.
A lot of the studies that we see so far, and there's only a couple, is that, there is misinformation for sure,
Mhm.
but we don't know the extent of it. And one of the things I want to flag, and it's great that you brought it up, was, it has real world consequences. So
Mhm.
vaccine uptake is a huge one. And we've seen with other social media platforms, they've resisted calls to kind of remove that content. So when we think of misinformation, I think one thing people miss is that we have to think of from the social media platform's view.
Yeah.
What is their incentive to remove it? The
Mhm.
whole social media platform business model is based on providing content for people to engage with,
Mhm.
right? And that's how they show ads. So not saying
Yeah.
this is particular to TikTok, but they want more content to show more ads. So
Yeah.
there's a bit of a conflict of interest there when we think of really how much misinformation do social media companies want to remove.
Right.
Because even, when we think of vaccine misinformation, you know, that's a bit more of a, I guess, pointed example. But there's
Mhm.
many others where people really engage with this content and they enjoy engaging with it, even if it's not good. So I guess the short way of saying that is that we don't know. We have to
Mhm.
look into these topics, but it has to be more than just COVID. And I have
Right.
to stress that a lot. A
Mhm.
lot of the research we've seen in the last year is COVID and election integrity. And those
Mhm.
two things are very, very important. But there's a lot more
Right.
misinformation and disinformation on these platforms that we really have to pay attention to.
So what are some of those areas that you suggest that we look into?
So a couple of examples I would say is a big one is like climate change denialism. I
Mhm.
think
Yeah.
there's a lot of research that needs to be done there. There's also just when we think of medical interventions,
Yeah.
things like cancer treatments, for example, a lot of people learn of these unproven, potentially dangerous or disproven treatments that people charge a lot of money for on social media. In some
Yeah.
cases, you can actually advertise for these products. And I'm not saying you can do that on TikTok, but
Yeah.
you can do that on social media platforms.
Mhm.
And that's something I think with TikTok we have to look into. Those are just a couple examples, but a couple more that I would say is kind of the representation of drug regulatory processes
Mhm.
related to the vaccine development. Election integrity, of course, is a big one. I
Mhm.
think we have to give conspiracy theories due process, and we
Mhm.
can't ignore it as kind of these fringe ideas because conspiracy theories can flourish on social media in the right
Right.
conditions.
Right.
But with TikTok, we just don't know because there hasn't been research into it. So we
Mm.
can speculate and, we might see some anecdotal evidence like, oh, we see a video here. This is my experience,
Yeah.
but we don't necessarily know. And that's why we have to look into it.
Yeah. And you kind of also mentioned this idea of corporate interest. What is social media? What is their purpose? And what is their ultimate objective? It's like, yeah, for people to engage with their content and to engage in the various things that they put, to have people more engage in their platform and be on their platform, to see these ads. And I guess TikTok being a for-profit corporate organization, there's this idea that you
Mhm.
also mentioned of corporate activities, right? And this kind of ties into one of your interests, the commercial determinants of health. So could you kind of tie those in together for me? And could you maybe
Mhm.
talk a bit about that?
Definitely. And I'll kind of introduce that in the context of TikTok. So with social media platforms, a lot of the time is because it's so regular in our lives, we sometimes forget that social media platforms are for-profit businesses. So while we might think, intuitively, oh, they would just remove this information, they would just remove misinformation, or, they would take all these public health recommendations, we kind of have to remember at the same time that they're businesses. So the commercial determinants of
Hmm.
health is kind of related to that and understanding how these kind of corporate actions can influence patterns of health and disease. So with TikTok, one of the things I think we should look into, and I'm not making any kind of assertion here, but we have to
Hmm.
look into their corporate interests. Like, what are their tensions with public health? What are their kind of like strategic processes? because those have public health implications. And sometimes if TikTok makes a decision, for example, that, is in their interest, it might not be in the interest of public health. And same with public health making a decision that might not be in the interest of TikTok. So it's kind of like, it's just something that we need to flag. And I think when we think of social media, and not just TikTok, but we have to kind of reassess, is TikTok really this public utility, or are they this business? And that has a lot of implications for how we regulate social media platforms.
Yeah, fantastic. And so some of the other key areas that you mentioned in this paper for public health concern is this idea for medical advice and health illness portrayal, viewing sensitive and hateful information, or problematic usage and addiction. So those are kind of the other three key areas that you mentioned. Do you have any kind of key points that you wanted to bring up in those things? Because they are in and of itself very important areas, and areas that have the implications to affect the health of people.
Sure. So for medical advice and the portrayal of different health topics on TikTok, we know anecdotally that people are viewing content related to public health topics. So for example, in our commentary, we do just kind of a search of some common health conditions and their hashtags and how many views they have cumulatively on TikTok. So one of the things though, when we look at that, is we have to kind of assess, okay, if people are talking about it, it's great. It's a good thing that people are sharing their story of mental health. They're sharing their stories of, surviving maybe a chronic illness or something along those lines. But there's this whole other side as well, where it's kind of assessing the accuracy of that information. And it's also asking, are the people who are sharing this information, do they have any conflicts of interest, right?
Yeah.
Are they selling a product? Do they have credentials to be saying that? And this is when it's kind of a similar theme I was saying earlier with misinformation, is very quickly we can get these ideas that have no basis in science flourishing on social media platforms. So for example, if I know somebody who's sick, say for example with cancer, and I'm looking for everything I can do, just being a really wonderful person, wonderful friend to this person. And I'm going through and I see a video saying XYZ intervention can help with cancer. That you're in a kind of, you're going to receive that information in a different way than somebody who isn't in that situation.
Exactly.
Exactly. So with that, it's just, that's something that we have to kind of keep on top of. And making sure that people don't get kind of exploited through that information, and making sure that if health information is on TikTok, how can we make it as accurate and safe as possible?
Yeah, and one of the studies that you mentioned in the commentary is this idea of, I think it was some sort of diabetes education study, where they actually found that organizations that were for-profit groups had poor quality information in some of these cases compared to some of the other actors in the space.
Yeah, absolutely. And, that study does a good job of kind of looking at different actors and kind of the accuracy of the information they give. But it kind of reinforces why we need to look into this more. I think in particular, when we're looking at the user base of TikTok, and we know it's young people right now, probably the biggest thing that we're going to look into public health wise is their mental health. So do they go to TikTok to learn about mental health, anxiety, depression, things like that? What kind of information are they getting, and how are they using that information? And we just don't know.
Yeah. And so one of the other things that you all mentioned is this idea of viewing sensitive, hateful content. And I guess in light of the last year, we saw a lot of anti-Asian racism in terms of the pandemic, and anti-Black racism. Are these things that you find could have the potential to, bring someone into the TikTok ecosystem, and through the algorithms that they have present to keep you engaged, steer you down that path to continue to see this sort of hateful or sensitive content?
Yeah, so that's definitely a concern on TikTok. So TikTok, to their credit, they have banned hate speech, and they do some good work to kind of support people who are affected by it on their platform. So with kind of like that positive, there also comes this negative though. typically how I view it right now is that when somebody posts a video or a certain kind of video kind of flourishes, if there's a harm, a lot of these resources kind of come after. It's kind of like supports or resource kind of page, or you can kind of take actions. I guess you could take them proactively if you wanted to, like restricting who can comment, that kind of stuff. But a lot of the times that's going to happen after. And we do know it's a concern. And right now we can't speculate too much because the state of the evidence is pretty weak. Right now, we know, for example, a recent report came out that transphobic content might proliferate on the platform because of the algorithms. And we see a lot of that to gender kind of advocacy, which is very problematic and can be very traumatic to some folks. From April to June 2021, they removed about 2 million videos that had hateful content. So that's a good thing. The kind of bad thing, though, is when we think of all the stuff that gets through, and we don't know how much really gets through because there's no research on it, is that could have some bad effects on the users. And it could also inform or suggest to some folks, if they kind of review that content repeatedly, that that's a truth, even if it's a problematic kind of idea. So it's one of those things that we don't know and we really have to pay attention to.
Yeah, exactly. That definitely an area that we need to see more research in. And then kind of that last area of public health concern is this idea of problematic usage and addiction. And we're talking about use that definitely affects, your life and your functioning on an everyday basis. So this idea of this endless scrolling and bringing people in, why is this an area we need to have more research on?
It's an area because we've seen in the past some anecdotal feedback, or we've seen through research studies as well, not specifically into TikTok, but that, social media use can manifest in ways which are very damaging for mental health. So we've seen associations of social media use with things like depressive symptoms, anxiety symptoms, and different mental health outcomes. So with TikTok, we just don't know. And I think I've said that quite a bit in our conversation, but it's the reality is that we don't really know. Kind of the evidence that we see is produced by TikTok, which is some evidence, but you have to kind of take that with a grain of salt when it's produced by the company who has implications from that result. So we need independent research to see kind of the attitudes of young people using it, how they view it, and if there is this kind of idea of addiction or problematic usage. Right now, what we see is kind of the speculation a lot in the media or in journalism. But you need research to look into that and kind of confirm some of these suspicions. And, maybe it's not the case, but I think a lot of the feedback we see warrants attention for sure.
Perfect. And so, we've pretty much gone through these 6, areas of public health concerns. First, starting off with this idea of health harming product promotion, this idea of disinformation and misinformation spread, corporate activities, the medical advice and health illness portrayal that goes on the platform, the idea for the proliferation of hateful content, and this problematic usage and addiction. And so your fundamental goal of this paper was this idea of public health should pay attention to the potential health-related implications that we discussed and see the opportunity of TikTok and the role that they play in it. And you want to suggest a research agenda to inform decision makers, health providers, researchers, and the public. So what are some of these practical items or suggestions you would like to have on a proposed research agenda for TikTok and public health?
Yeah, that's a great question. And they kind of relate to those themes that we talked about. So for starters, I think with health harming product promotion and a lot of the content on TikTok, we need kind of auditing a little bit from independent perspectives, just to see, for one, if these community guidelines that they've put out are being adhered to and how much they're being adhered to. And I don't not recognize how hard that must be for TikTok to kind of moderate all this content. But ultimately, they profit from the content and it is their responsibility. Some more things I would like to see is a bit more funding attention to TikTok and research. Right now, we see a lot of the funding going to understanding things like Facebook, Instagram, which is really good, but we have to make sure TikTok's kind of included in that spectrum of funding. We also need research into the accuracy of health information on TikTok. We have to make sure that the information is as accurate as possible when there's kind of a harm that can be done. And we also need to look into misinformation and disinformation. I think practically, public health can utilize TikTok for its benefits, for sure. I think when public health uses TikTok, though, they kind of have to keep in mind some of these concerns that we've brought up. And I think most public health professionals already kind of have these ideas in the back of their head. But it's more so, how can we use TikTok in a way that kind of supports public health work, but keep it as safe as possible for the users, and make sure that we're not unintentionally kind of, benefiting from these social media tools that could have some concerns for the user base that uses it. So I think moving forward, it's just kind of use TikTok for sure, but make sure we're using it as safe as possible. And let's make sure we hold TikTok accountable as well.
Wonderful. And Marco, do you have any take-home messages that you want to leave off with?
Yeah, I have a couple. I think I've said this throughout our conversation, but this research is very urgent. When we think of how many people use TikTok, really reflect on 1 billion people using TikTok. This research needs to happen almost immediately to understand, because it has public health consequences if we don't know. We also need to make sure that where that research happens isn't just in the United States, Canada, Europe, and Australia. We have to make sure it has this global scope. We've seen in the past that social media platforms have acted in this way where they kind of prioritize these markets at the expense of others. So for example, we look at Facebook, from the recent Facebook files, we saw that 84% of the misinformation and hate speech budget was in the United States, even though that's a fraction of its users, right? And we see different standards of some of these issues and that's something that isn't okay. And we have to make sure that all this research is happening, but it's happening everywhere. I would also just underscore that the user base warrants a special consideration as well, that it's kids and children and young people who make up a lot of the base.
Fantastic. All right, Marco. And I mean, you're doing such a fantastic job advocating for this. And, like you mentioned, as one of the reasons why you want to do a PhD is to be at the forefront of this advocacy piece. And I think what you're doing, combining these commercial interests, public health interest, mental health interest, and your interest in misinformation, this seems to bring it all together. And I'm so glad that you put out this commentary to put it out there, that research on TikTok, there's so many things that we don't know. And as public health professionals, given the impact of what this can do to the populations in terms of health outcomes, this is an area that we should have more information on. This is an area we should do more research on. And by you publishing this paper with your colleagues, I think we're getting ramped up, and I hope in the future, in the coming, hopefully, like you mentioned, in a couple months, years, we'll have a lot of information on a lot of these social media platforms, and we can use that to our benefit as public health professionals. So thank you so much, Marco.
Thanks for having me.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.